Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Next, coming to the investigations part. If you are experiencing any of the signs and symptoms we have already discussed in the secondary dysmenorrhea part, that is abnormal bleeding, it can be any irregularity from the normal, then you should be doing a doctor consultation. And when you're going to consult a doctor, first thing that they will be doing is taking the history and the physical examination. What is taking history? They will ask you what was your last period, how was your last period, how was your before last period, and then any changes that you have experienced over the period of time, your genetic history, all of this stuff will come under play. And then they will do physical examination. If needed, they can do a bimanual examination, and then they can also palpate your lower abdomen region for pain. After doing all of this necessary things, they will be advising you for some investigations. So let's see what are the investigations. If you are suffering from signs and symptoms related to the secondary dysmenorrhea, they can ask you for investigations. The primary one being pelvic ultrasonography. If you are experiencing any of these abnormal symptoms, first and foremost thing that every doctor will advise you is go for pelvic ultrasonography or USG abdomen and pelvis, as we know. So if there is any problem, it can be primarily detected in this USG. If you can't detect anything, or if there is a question mark, sometimes the radiologist puts a question mark, like go for an MRI because we are not able to diagnose the condition properly. Then you can go for an MRI to know what it is. And then after MRI, if they are not able to make a proper decision and they want to view it betterly, they can do a laparoscopy as seen in the picture. As you can see in the picture. See, by doing laparoscopy, what they can do is that they will be able to view if there is any PID, that is pelvic inflammatory disease, which is also a cause of secondary dysmenorrhea. They will be able to view in a better manner and to see what the problem is actually. Or if there is any appendicitis and not true menstrual problem. So they will be able to differentiate, and also they will be able to predict what is the cause of the secondary dysmenorrhea. Apart from this, there are certain things that you need to do, such as laboratory investigations, which include CBC, which is complete blood count. Why do you need a complete blood count for pain? Is that, see, if there is any sort of inflammation in the body, there is raise in the WBC cells, that is white blood cells. To know if there is any sort of inflammation in the body or infection in the body, you need to do CBC along with ESR, that is erythrocyte sedimentation rate. If there is any active infection, there can be increase in the pain scale without any problem in the female reproductive system. So to differentiate if it is a female reproductive problem or a systemic problem, we have to do CBC and ESR. Apart from that, we should be doing gonococcal and chlamydial cultures. If there is any sort of difference in the thickness of your white discharge, color of your white discharge, or the order of your white discharge. Okay, so we have to check for gonococcal and chlamydial infections, because they can also lead into or cause a little bit of pain or increase in the pain index during menstruation, and also they can cause itching. Because gonococcal and chlamydial infections, we have to do this culture to know how they are affecting, or is this being related to the pain. Next is the human chorionic gonadotropin is the next test, which is HCG, which is very common that we do to predict pregnancy. So how is pregnancy related to this secondary dysmenorrhea is that if you're pregnant and if you're ectopic in nature, the pregnancy is ectopic nature. What do you mean by ectopic pregnancy is that the implantation usually, that is the fertilization, that is the ovum and the sperm meeting together to become a zygote, happens in the fallopian tube. And then it should come down to the body of the uterus to attach itself. But if it is still there and it is growing in the fallopian tube, that is the fetus is growing in the fallopian tube, it has to be removed and it will cause severe pain. So this can also be evaluated by HCG. And then erythrocyte sedimentation rate, which we have already discussed in the CBC part. Urine analysis to know if there is any UTI associated, because UTI can also cause pain, and in the if you are menstruating during the UTI attack, the pain index can increase and there might not be an actual problem in the female reproductive system. So all these tests are to differentiate if there is any problem in the reproductive system or is there any problem in the surrounding tissues. And then even stool examination as well to know if there is any problem in your colon. So these are the basic tests that you need to do to differentiate it. If you're someone who is experiencing pain during every menstruation and you want to decrease it, that is primary dysmenorrhea. And if you're someone who is experiencing pain along with other abnormalities in your flow, that is secondary dysmenorrhea, and you would like to get in contact with us, we have two kinds of consultation options. One is the online consultation, the second one is the offline consultation. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you're someone who is staying far away from us, you can contact us online. We have two options, that is audio consultation as well as video consultation. After the audio and video consultation, if we think you are suffering from secondary dysmenorrhea, we will ask you for investigations, or if you have already done investigations, you can send it to us. And after the doctor consultation and after the whole process is done, your medicines will be delivered to your doorstep. That is, home delivery option is available, where if you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And if you're staying anywhere else, it can take 4 to 8 business days for our medicine to reach your doorstep. If you want to consult us, you can call us on this number. You can WhatsApp us, you can message us, or you can call us. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. So if you're someone who is experiencing painful menstruation and you do not know what kind of painful menstruation it is, that is primary or secondary, or if you're someone who is experiencing pain in every menstruation and you would like to get rid of the pain to have a better work-life balance, or if you're someone who is experiencing pain along with the abnormalities, that is female reproductive problems, you can contact us. And also, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we have 3 principles. One is the highest success rate. See, we are already experiencing a rush of patients who are approaching us for different female reproductive problems, and the success rate is really high. It is good. And also, there is transparency in treatment. That is, that there is no gray area between the patient and the doctor. Any sort of prognosis that you should be knowing, we will be letting you know. And also the personal care here at Fidicus. If you have any sort of myths, or if you have any sort of queries regarding your own problem, we will be educating you. And not only that, we will educate you in all aspects of your problem. So if you want to choose cure, if you want to choose a better life, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.